Good evening and welcome to this week's edition of Roundtable Talk. This evening we are having a dengue roundtable. As most of you may know, we have had an upsurge in cases within recent times, and to talk about what is being described as a dengue epidemic here in St. Vincent and the Grenadines. In studio with me this evening we have District Medical Officer Dr. Deslyn Quashie Browne. Welcome.
Thank you.
We also have Senior Environmental Officer Carlos Wilson. Welcome to you as well.
Thank you.
Let's start as always with the basics. What is dengue?
Well, dengue is really a viral illness that spreads from mosquitoes to people. And for those out there who are not sure what a virus is, it's just a bug that lives inside something. And in this case, it lives inside a mosquito. In St. Vincent, we have different types of dengue strains and over the world. So you can have dengue 1, 2, 3, and 4. Currently, the strain that is going around here in St. Vincent is the dengue strain number 2. Dengue, as I said, is spread by mosquito. And there are 2 different types of mosquitoes that carry the dengue virus. And one is called Aedes aegypti, which is in our specific area in St. Vincent and the Caribbean region. And there's one called Aedes albopictus, which tends to be more in places like Europe and North America. Okay? What does it really look like? Persons can go online and check it out to see what it looks like. It usually has these white stripes that looks like zebra stripes on top of the legs and bodies.
You can actually see that?
Yes, if you microscopic view, you could actually see it, right? And you know, on the internet, you can actually zoom, and they have a lot of pictures there. You can check it out. When persons want to know when they bite, they can bite at any time, but particularly in the mornings and evenings, okay? Somebody asked a question about, do they actually bite at night? I mean, if they're in your house in the day and you have a bunch of light and your house looks like daytime at night, they can also bite, okay? It is also important for us to know that Aedes aegypti transmit other diseases. Dengue is one of them, but yellow fever, chikungunya, and Zika are some of the other viruses that the same mosquito transmits. And only the female mosquito is responsible for transmitting the virus once it goes into the blood. It actually takes, for the virus itself to develop inside the mosquito, it takes about a week or so. And once the mosquito bites you, if you're to develop dengue symptoms, it will go for 4 to 12 days before you actually get any form of disease showing. But not everyone gets the disease. You can have mild symptoms. Persons fight it off very easily. And some persons are what we call asymptomatic. They don't have any symptoms at all. It is also important to know that once a mosquito is infected with dengue, it can infect anybody. And mosquitoes can bite more than one person in a feeding. So that means if you're in a room like, Lord, not this room, because I don't hear it in here, but in this room, hungry, greedy mosquitoes can bite all 3 of us, okay? And as long as the mosquito lives, which is about 3 weeks, the mosquito can actually spread dengue during that time. So you see how important this is to actually get rid of them, because 3 weeks of biting multiple persons means that there's increased risk of spreading. Okay? Now, I want you to know some more about the transmission. Some persons are concerned about mother to baby transmission. And there's no direct transmission of the virus from the mommy to the baby. However, if the mommy becomes really sick, for example, dehydration, there's bleeding in the severe cases of dengue, the baby can have problems, whether it be breathing problems. It can come before its time, or what we call preterm labor, right? Some people also wonder if you can get it from other animals. Well, studies have shown that other animals can get dengue, like pigs, bats, birds, even horses. However, there hasn't been anything concrete to say that
they can transmit it to
right,
humans.
they can transmit it to humans if a mosquito is to bite a pig and then bite me, right? When there's nothing conclusive about that, and there is nothing conclusive either that these animals actually show symptoms, okay? What about people traveling? Because you always ask questions at the clinic when we see patients, your travel history. Remember I said before that the Aedes albopictus, which is the other variety of the Aedes mosquito, is in places like North America and Europe. So if somebody has dengue and is bitten by that mosquito in Europe, and they come here, 4 days after, they could actually spread that mosquito, can bite that person, and they can actually spread that virus, that dengue virus here. Now, the problem with that is that different areas have different strains and severity. So what that means is that we get interstrains, right? And that is also one of the things that we have to look at when it actually comes here. Because like I told you, we have type 2 here. If we see a new strain coming in, we would wonder where that strain comes from. We need to figure out. So that is why we usually ask patients certain questions like that, so we can have like an epidemiological view of certain things around that line.
What is the difference between the various strains? What's different from 1, 2, 3, 4? What is the difference?
Really and truly, it is something that you will test in a lab, and it's good to know that we actually do the testing here. A lot of them have the different strains have similar symptoms. Sometimes you can't really pinpoint one specific thing, but I know some of them are more severe. Some may potentiate increased risk going to like the dengue hemorrhagic, which is where you have more bleeding and go towards shock, versus some will be milder and you can have just rash and the headache and the fever symptoms and so on, right? So that is one of the things. It's nothing specific, right? But they're very similar, hence why we really test for this strain. And once we get this strain tested, then we could go back now and look at the symptoms the patient would have had. But there's only 2 we seem to have here at the moment. So most of the patient's symptoms are very similar. Yeah, so what are the symptoms and signs of dengue? Like I said, they can range from mild, can moderate to severe, and even fatal. And we've had all of those things here in St. Vincent. Of importance, fever. Okay, the fever is usually very high. For those of you who are familiar with your thermometers and so on, 40 degrees Celsius to 104 degrees Fahrenheit. Many persons would have subjective fever, meaning that you would feel that you're hot. The other thing, they might come with lower fevers, maybe like 100 degrees Fahrenheit, but persons would, once they get fever or pain, they take paracetamol. So most of the time, by the time they come to the clinic, the fever never reaches so high at the point when they actually come for care. Okay? Now, headache. Headache is very prominent, and it's one of the early symptoms. The headache is usually severe. It feels like, for those persons who would have had migraines, it feels like a migraine headache. And it is usually in the center of the head and associated. Center of the head, when I say center, like if something is pulling and shocking in your head, that's how severe it actually feels. And it's associated with eye pain. And this eye pain is like in the back of the eye. When you move your eye, it feels like your eye wants to pop out, according to some of the patients that we've had, right? So, and that is usually also coming along with the fever. Muscle and joint pains also happens. Sometimes dengue is usually referred to as what you call bone break fever, right? So you know, if it referred to as bone break fever, there's a lot of pain, right? And what I've noticed is that even if they have muscle pain and joint pain all over, if you've had an injury to, say, your elbow, or you've accustomed to have chest wall pain, something called chondritis, costochondritis, right? The pain that you have tends to go in that area more. Patients who have arthritis, they complain of more severe arthritis type pain in areas that they're accustomed to having pain in. Okay? Nausea and vomiting is also very common. Persons may not have diarrhea, but some can go on to have diarrhea. Severe weakness, decreased appetite, and a lot of them end up having dehydration because of the vomiting, they can't keep down anything, and the diarrhea. There might even be cough and cold symptoms. Some of them might be sneezing, might have a dry cough. Some might even have runny nose. And this is where we as physicians, we as doctors have to really figure out what's going on, because a lot of viruses have the same thing. Patients with COVID have the same
I was about to
symptoms.
ask you if these symptoms don't mimic other ailments.
We had influenza the other day, it's still around. So we have to really ask a lot of questions about their home situation. If anybody is sick at home, eye pain specifically and headache, the type of headache and the eye pain may give us a more, like a clue to say, boy, yeah, I feel like it's dengue, right? But a lot of times, we really just need to do the test to confirm and give the precautionary management for it. Rash is another one. We haven't seen a lot of rash this time around. The last dengue outbreak we had, my daughter had dengue and my son had dengue. God, please don't make them have this time, right? But she had a rash, but he didn't. Okay, and the rash was all over the body, and it's usually like heat rash, but it's fine when you feel it. It's rough. It may itch or it may not itch. Okay, and I'm really and truly half the dengue patients do not even get rash. Today I saw a patient, and she had severe symptoms, and her rash was in a weird place, like coming under her arm. And between her breasts coming down to the front of here. It wasn't there before. She had no history of rash before. She continued to have fevers and the rash appeared. Now, that rash could spread to all the rest of her body as the time goes and her symptoms increase. Okay? Severe abdominal pain. Now, you notice I'm going from the early things to when they start to get a little more severe.
So you'll distinguish now between dengue and severe dengue.
Right.
Yeah?
So these symptoms that I had mentioned before, they come in the mild. When you start to see the dengue really getting bad, is when you start to have things like severe abdominal pain. Now, the abdominal pain, we ask questions, because if you're not eating, you're vomiting, your belly is going to hurt. There's going to be acid building up there, gas, right, cramps from colic and so forth. So your belly will hurt. But you cannot say, boy, maybe it's gas, because you're going to ask other symptoms. The fact that they're debilitated by this abdominal pain, you cannot rule it out, because it is better you think the worst there than not, and then you do for the patient survives, and you say, no, you can just go home, and then you find out the patient got worse and died. You don't want that on your plate at all.
All right, we'll take our first break. When we come back, we'll talk about where does environmental health come into the whole scheme of things, and also talk about what I should do if I suspect that I have dengue. We'll be right back.
Read, learn, grow. The children are the future. Help them read, learn, grow. Only reading is the key, so help them read, learn, grow. Let's show them how much fun it is to read, learn, grow. So parents, you play a part. First and foremost, reading from so young is advantageous. Link with the teachers. Working hand in hand is a must. Just 10 minutes of your child reading to you is a plus. Get fun books, make reading priority. When children read, they are able to learn, and the more they learn, the more they grow. So parents help the kids read, learn, grow. Reading is fun, kids have to know. Read, learn, grow. The children are the future. Help them read, learn, grow. So parents, You play your part.
This message is brought to you by the OECS USAID Early Learners Program, funded by United States Agency for International Development. For more information, log on to www.oecs.org/ELP.
Win back-to-school supplies from the National Lotteries Authority. Simply combine $5 worth of non-winning Instacash tickets along with $10 worth of non-winning scratch tickets. Provide name and contact number and drop-in box provided at active lotto agents island-wide, qualifying you for 2 grand draws where you can be one of 20 winners of $1,500 worth of school supplies. First draw August 30th and the second on September 13th. Get your Instacash and scratch tickets and win back-to-school supplies from the National Lotteries Authority. NLA terms and conditions apply.
Stop this.
Welcome back. Just to remind you that you can send your questions and comments to our WhatsApp number, which is 493-5332. That's 493-5332, or you can do it right here on our Facebook or YouTube page. When we took the break, you said you wanted to mention the question of bleeding.
Yes, I wanted to mention bleeding because that is also one of the things that would suggest that the dengue is getting severe. Because a lot of persons would have, for the last dengue outbreak, persons wanting other persons to donate blood. Okay? So bleeding is very real when it comes to dengue. Persons may bleed from their mouth or nose. They might bleed in the urine. They might see the urine red. When they stool, even when they vomit. Today, I had a patient. She has hemorrhoids. They were fine. And then all of a sudden, the hemorrhoids were bleeding. So that, therefore, also make me think that, okay, she's having some severe symptom, especially when there's the abdominal pain. Okay? So I just wanted to make sure I mention that there. How do we know it may be that for persons like that? When we go into the treatment and how we investigate, I could go more into that as well.
Okay. So are you saying that if it's not severe dengue, I shouldn't be that overly concerned or worried?
No, if it's not, dengue has a flow, in a sense.
A progression.
A progression, right? Mild, moderate to severe symptoms. Now, you can, once you have the symptoms, you treat the symptoms early. You don't have to reach that stage. Now, if you're healthy, strong, you have good immune system, you might be able to deal with the mild symptoms. Persons who have diabetes, hypertension, blood disorders, sickle cell, cancer, kidney problems, I'm naming a lot of the things that, other illnesses, they are more at risk. Children, pregnant women,
compromise the immune system.
Compromise the immune system, and they can go into the severe form of dengue. And we want patients to know this. So if they're having those symptoms, persons out there, not patients as yet, or we don't want them to be patients, okay? But we want them to know that there's a severe part of it. Now, if you go into that part, there's an even more severe part where you could go, your organs can actually fail, your vessels can leak, that's blood vessels, fluid can go out into this, you could actually lose a lot of fluid, become dehydrated even more, not just dehydrated because of vomiting and diarrhea, but in your body itself, in the vessels, and you can go into shock. Fluid can even go into your lungs, and you can die. Now, sadly, in our system, right, we had someone that died very close to us, a child that actually died because of severe the shock syndrome. Okay, one of our colleagues, her daughter would have died last dengue epidemic, right? Yeah. Because of it went from when it was normal, simple, then it went into the fact that she ended up having vascular issues. And if you look back in her background, she would have had maybe, when she was born, some issues with her heart that wasn't affecting her before, and then all of a sudden it may have proved important in the form of dengue. Okay? The mosquito decided, the virus decided that that is where they were going to attack, and causing her to go into shock.
Where does environmental health come into the whole scheme of things?
Pleasant good evening, once again, viewers. Now, at the Environmental Health Department, we have the Vector Control Unit. Well, as we're accustomed, the guys who go around to check mosquitoes around the house, that's how we will view it. We refer to them. So what we're doing is to do integrated vector management, where we have, persons accustomed to seeing us doing fogging exercises and think that that is all that we do. But we're involved in biological control. It has to be a number of activities simultaneously, where we will add larvivorous fishes to water bodies in stagnant areas. We do physical activities in that environmental manipulation. That is where we will go around cleaning your drums, like turning over, advising persons to screen the drums, advising them to scrub around the rim, because what happens is that Aedes aegypti mosquito will always lay where the water line is, right? Because the intention is that as the water level rises, the eggs will now get moisture in order for them to hatch. And she will lay it in such a way that in containers that have enough organic matter to take them through the life cycle. So by us going to overturn and showing persons how to clean their drums, screen them, that is one way of physically removing the eggs from the source, which is most time the drum around our yards, because we tend to harvest a lot of rainwater. We have the chemical intervention, which is the addition of larvicide, and adulticide, which is the fogging exercise that we do. So all that together is referred to as source reduction. Also in the biological control, we have the addition of what you call BTI, which is a bacteria that prevents the larvae, because the larvae feeds, the pupa doesn't, which prevents the larva from maturing because it clogs the digestive system, so the larvae will die. So we do the biological control that we are accustomed, million fishes as we call them. We'll add those two spaces. We have the physical, we have the chemical. And we have, of course, ongoing public awareness campaigns. We have teamed up with the Health Promotion Unit. We are going out to highlight the importance of the maintenance of our environment and so on within the public. And one-on-one public education as we interact with the household on a daily basis, the reason why you have to turn your drum, the reason why you have to screen it, the proper and safe harvesting of water. We'll advise persons, in most instances, what we try to push is putting a tap on the base of your drum, because we understand there are some places that you have challenges with water. So if if you screen it, you're going to have the tendency that each time you go into the drum, you have to remove the cloth. It becomes tedious, right, the screen. So if you screen and tap, is that when you're ready to use, you just open your tap, you fill, and you can get a cheap PVC tap, right? And you keep that barrel like that. What the unit will advise persons also is that when you're collecting water in large receptacles like barrels and drums, is that you use empty plastic containers, maybe a 1 gallon Clorox bottle as we call it. So it will float, preventing the mesh from getting in contact with the surface, because the mosquito doesn't require a large quantity of water to lay, hatch your eggs, right? So by doing that, that becomes a flotation device, pushes it up. So it doesn't have this indentation into the water. So it's a number of activities, as I indicated, and the continuing education one-on-one, and the public awareness where we try to reach the masses. Because last Saturday, the team was in Calico, and the health promotion unit, we had a roadshow, right? Came Gibson Corner and those areas, Kingston, and we intended to hit every village, bringing the message of preventing the breeding of mosquitoes, keeping our environment in that manner that would not allow the breeding, and of course, the message of the dengue.
How receptive has the communities been?
Well, the thing is that you will have some resistance sometimes. There are persons who will tell you, they will actually threaten you. There are persons who will say, if you turn over my water, I will chop you up in local parlance.
Wow.
Right? Mm-hmm. And they'll get aggressive. However, is that if it gets to that, we always have the support of the police. So I'll tell, in our response this year, is that we have EHOs that are working with the team in the respective areas. So if there is resistance to the state where the officers feel threatened, you just go to the nearest police station, and they are always willing to assist us. We pray it doesn't come to that in a number of instances where people resist, because most times when persons resist, those are the persons who are the continuous breeders. You, as I have a colleague in Antigua who is in environmental health, he said Antiguans are breeding mosquitoes as pets. And I'll say the same thing for us. Because when you go into a yard and you have 5 55-gallon barrel drum breeding mosquitoes on a continuous basis, this week, 3 months after, 4 months after, they'll still be breeding. That is being presumptuous. They would refuse to screen. Sometimes they refuse entry. So you do have that kind of pushback from the public. But generally, the public is receptive.
Okay, we seem to have quite a lot more mosquitoes at this particular time. Any reason for that?
Well, there is linked to mosquito, the mosquito life cycle and climate change. With the rise in temperatures, you have shorter life cycle. Usually a typical life cycle goes to like 7 days. Now you'll have mosquitoes 5 days from eggs to adult, from the time the female lays to the adult stage, right? So egg, larvae, pupae, adult, 5 to 7 days, and can be reduced. The other thing is that we're just out of a dry spell, and a number of persons were harvesting rainwater. We try to advise the safe harvesting, as I said before, with the screening and tapping. That is a contributory factor. Our garbage disposal is used to, but around this time, as I said earlier, the climate, the temperature is obviously, we can feel it. It's really heated. Now the rain is falling. Is that, bear in mind that the female mosquito will lay her eggs with anticipation that things are going to change, things are going to get better. So she deposits her eggs and leave them there for the next rain season, and the next quantity of water to be deposited, and they will hatch because they can withstand extreme temperature.
The average lifespan of a mosquito is?
Well, as we heard before, about 3 weeks.
3 weeks. Yeah. So they come.
Considering environmental conditions.
3 weeks.
Yeah, they can be affected by other environmental conditions.
We'll take our second break and come right back. Back in just a moment.
Win back to school supplies from the National Lotteries Authority. Simply combine $5 worth of non-winning Instacash tickets along with $10 worth of non-winning scratch tickets. Provide name and contact number and drop-in box provided at active Lotto agents island-wide, qualifying you for 2 grand draws where you can be one of 20 winners of $1,500 worth of school supplies. First draw August 30th and the second on September 13th. Get your Instacash and scratch tickets and win back to school supplies from the National Lotteries Authority. NLA terms and conditions apply.
Welcome back. So I suspect that I may be infected. What do I do as my first line of defense?
Okay, so with respect to treatment, most of the time you get a fever first. We usually ask patients to take things like paracetamol, Tylenol, cocodamol, Panadol. Those are some of the common ones that are there. You can actually get it at the shop. For a can is like $2 now or something like that. You can get it at the pharmacy. Cetamol, there's a plain cetamol, not the cold and flu cetamol. You can also get those as well. We don't recommend persons going to take things like ibuprofen or Advil, Motrin, diclofenac or Voltaren, aspirin.
Oh, yeah.
So a lot of patients with hypertension and so on, diabetes coinciding, they usually take aspirin, baby aspirin. All of those things can contribute. Why we don't want you to take those things on a continuous basis with respect for your pain and headache and for fever is because it increases the risk of bleeding. Okay? So dengue is epidemic now. Therefore, what we do is you're not sure what you have. If it's flu or not flu, don't take the Advil. Go preferably to paracetamol in that case. Now, if you're starting to vomit, you can't keep anything down, you are advised to seek medical attention at your clinic because unless you have things like gravel at home, then really and truly you would need to get something injectable, some injection that would help you to ease the symptoms of the vomiting. And to an extent, if you're continually vomiting, you become dehydrated, you're going to need to have some hydration, whether it is through IV fluids or otherwise. Okay, so those are some of the things. With respect to the rash on the skin, we don't really do much for the rash because it usually goes on its own. However, if it is irritating, you can use mild hydrocortisone, a steroid cream to help with the itching, or you can even use calamine lotion if it's really, really bothering you that much. Okay. I want you to know there is no specific treatment for dengue in itself. So what we really treat are the symptoms of dengue. And I want persons to know that if you had dengue last dengue epidemic, you can get dengue this time around. The different strains, remember I told you have 1, 2, 3, and 4. If you've had dengue 2 last time, you're not likely to get dengue 2 this time. That gives you immunity. However, it doesn't give you immunity for the others. Okay? Rest is important. Building your immunity is important. So things like vitamin C, fruit juices, herbal teas. Now, I'm one of those persons who listen to patients when they come and speak about bush. Because whether or not you tell patients not to use it or to use it, they're going to use it. So I always ask, have you taken any bush so far? okay, and I go and I do my little research to see what it is. Now, the bush that is very important here at this point is the pawpaw or pawpaw bush, okay. Research has shown that, remember I told you about the bleeding? Now, there is a risk of bleeding when you have dengue, and that pawpaw bush actually helps the cell, if you want to call it, that helps you to clot blood. It increases that in your blood. So if you are bleeding or at risk of bleeding, it increases it or helps to build it back. So your time of bleeding will decrease, go back to normal, and your symptoms of dengue would literally be shorter. That is what some studies would have shown. So currently, when patients come, we advise them to use it because you want to get out of this sickness part.
Is there a special way to use it?
Yes. So you can have it as a tea. You can have it as an elixir. And when I say elixir, I mean like concentrated with honey, really sweet enough, because that thing is bitter. Yeah? And some patients don't like bitter things.
It's an acquired taste.
More than an acquired taste. In some places, they actually have a tablet. But you have to buy tablets. And we have plenty of pawpaw trees all around us.
There's a tablet made from the
Yes,
pawpaw.
I haven't seen it here,
Okay.
but the research has shown that they actually have a tablet, a pawpaw tablet specifically for things like that, to help with increasing the platelet count.
Okay.
Now with the tea, you do it as any bush. You boil it, let the water be green, not black. Because some persons, they think if it's black, that is it. Black is no. There's no black tea, right? So or you can steep it where you put the hot water on the bush and wait a while for the color to change. Then you can drink it as a tea 3 times a day. You add your sugar as you want, because some people don't like, they say it's not going to work without the sugar. It will work, okay? Now the elixir is the harder one to swallow, because this is where you actually grind up the leaves, throw the hot water, and then literally like squeeze it out. Then you put the honey in it and that. Now for that one, what you do for adults is you can use 20 to 30 mils, okay, 2 to 3 times a day for 5 days, or until the symptoms improve. That is for adults, okay? And for children, okay, anybody below 5 years, please contact your doctor to see how much, because we do not want you to go and give the children 5 and 10 mils if they're very young, okay? We could discuss it as a physician with you to see how it would work for you, okay? Now, 5 to 10 mils is usually for children. Same thing, 2 to 3 times a day for 5 days or so, until symptoms improve. Now, you need to look for a reaction. Reason being is because some persons can be allergic to bush. When we had the dengue epidemic the last time, my son was unable to take the bush because he had an allergic reaction. So his symptoms lasted longer. He ended up in the hospital when my daughter was fine, okay? Because she was able to drink some of the pawpaw, yes? So that is some of the things that we would tell patients in the clinic setting. When they reach to the severe symptoms, we refer to hospital. And from there, they would either decide to do, with respect to testing, they would do the dengue test. In St. Vincent, before we used to do a convalescent test, maybe like after you've had symptoms for 7 days, then you do the test. But now we do PCR, so we can detect if you have dengue in the first 1 to 6 days of your symptoms. And once that is positive, then we say, oh yes, we have the dengue. We have other blood tests that we do. We check for your platelet count to see if your blood count is, persons would say if the blood low, okay? So if there's anemia or something called the hematocrit, okay? Those will give us a predictor of your risk of bleeding and so on. And they might have some electrolyte imbalances and so forth. But hospital usually, we transfer from the clinic setting to hospital for further management. And that would depend on the severity of the patient and what illnesses the patient would have had from before. So the management would vary when they go to hospital.
Okay. A couple of years ago, I did some blood tests and was told that one showed up that I had in fact had dengue, but I can't recall having any symptoms or anything like that. But
maybe you're one of those asymptomatic people
Yeah.
we mentioned earlier, right? Well, you know, everybody talking about vaccines now, right? So they tried vaccines for dengue, but some of them haven't been, you know, available for people to use because they don't work.
okay.
Okay? So it's either they work okay for some persons maybe who had dengue before, but then it sent persons who never had dengue before to the hospital and for worse symptoms. So at this point, there's no vaccine that is safe for dengue in our situation at all.
Okay, we'll take a final break. When we come back, we'll talk about how to manage the prevention of dengue from one personal as well as the household level. Back in just a moment.
Win back to school supplies from the National Lotteries Authority. Simply combine $5 worth of non-winning Instacash tickets along with $10 worth of non-winning scratch tickets. Provide name and contact number and drop-in box provided at active lotto agents island-wide, qualifying you for 2 grand draws where you can be one of 20 winners of $1,500 worth of school supplies. First draw August 30th and the second on September 13th. Get your Instacash and scratch tickets and win back to school supplies from the National Lotteries Authority. NLA terms and conditions apply.
Welcome back. It said that a community approach is the best approach to be used in the management of dengue risk. How do we approach this as a community? What is the best approach?
Well, as we mentioned before, is that the public awareness is the public awareness drive is to sensitize persons individually when we do conduct house-to-house or premises inspection. And when we see issues in the community, we tend to bring it to the fore. So for example, the issue of like blocked drains, where you can work along with community groups and individuals who are willing to do any clearing, because a number of drains tend to be blocked, as I said before, with our poor garbage disposal practices, debris coming down and blocking drains and that kind of thing, stagnant water in ravines. We have a special inspection team within the vector control unit. They will go into these ravines and the streams to ensure that there's no ponding that's breeding. And where you may find that you need community involvement is that you will approach groups and willing individuals to get involved in the whole dynamics of getting it cleared and maintained.
Do you think people take dengue seriously?
No. I heard a doctor talk on the side there, and I remember years ago as a young officer in North Leeward, I contracted dengue. And a physician prescribed, I ended up taking ibuprofen. And I started to have bleeding. Ended up in the hospital an entire week. I keep saying that dengue is one I would not wish for my enemy, if I have an enemy. It's not an easy disease to live with and experience. It shakes from the head to the toe, ache, pain, and all these severities that and conditions that come with it. But I don't think we take things seriously as it relates to dengue, because if we were taking it seriously, our response as individual householders and property owners and the community will have a greater response to the whole situation, even before now, before it become crisis state, because the information is out there. Even on YouTube, you can Google everything now, right? To show you proper harvesting technique for water, how to control the Aedes aegypti around the home, because we would have heard that you have two of interest, but the Aedes aegypti is the one that we are more concerned about. So continuous breeding of mosquitoes around properties and within communities, we're not serious. We're not serious. We're not doing enough as a people. Because we alone can do it. As we say, the Ministry of Health is always a shared responsibility. So we come to your property, we show you how to clean the drum, we show you how to screen it, and then 3 weeks after, you're gone back to square one. So that is evidence that we're not really,
New culture needed, I guess.
It has to hit home. When it hits home, that's when people wake up.
Mm-hmm.
Chikungunya is also caused by a mosquito.
Mm-hmm.
How do we know?
Which one you have?
Uh-huh.
So when you send for the blood test for dengue, they check also for chikungunya and Zika. So if there was any, we would know when it comes on top of the form. Once the form comes back to the physician, patient brings back the results, or they call you from the lab, send your email, whichever it is, to get the result. It would either have negative for chikungunya, negative for Zika, positive for dengue. So we can actually test for those three here.
What is the difference between chikungunya and dengue?
With respect to symptoms, most of really and truly, for chikungunya, when we had it the last time, a lot of persons had a lot of joint pains.
So debilitating.
Really, really bad joint pains. So if you want that same, clue-like to say maybe it's that would have been one, because persons had it so bad that they couldn't walk. And so I even had an aunt who, she had cancer, and she would have contracted it when she was okay-ish, if you know what I mean. And then after she got it, she started walking. The cancer just went, and she was bedridden.
Yep.
Okay, so that is one of the clues. Now, then we check it via the test to confirm, because a lot of these symptoms are very, very similar. Very, very similar. Headache and so. You might not get necessarily eye pain so much for chikungunya, but that joint pain, boy, that is one of the hot ones for that, for sure.
Okay, and before we go, what would you like to tell our viewers or listeners about how best to prevent?
Well, we already got the public, the vector control perspective, but we in our little space at home, we spray our, our Baygon and household sprays. However, that might not be as effective because of the timing, and we already know that the mosquito is going to be there in the day. So maybe when you come home in the evening, you spray your cupboards and so forth before you go to bed. That might help as well to decrease some of the mosquito, because you would have already closed in your house. Whatever is in there, you spray it. That may help. But what I like to use, and I find it works much better, is insect repellents. Things like, there are many different brands, things like Off, Cutter, there's Odomas, they're at your local drugstores at different prices. Citronella people like to use. There's a different timing for the different brands. So for Off, you might be able to have up to 10 hours of protection, and it also goes for things like sandfly and so on. One time, I swear to you, there was woodlice, and it killed woodlice. So I'm just saying, it's strong enough to help prevent mosquitoes from biting. Because sometimes you can't even tell what is biting you. Is it sandfly biting you, or is it mosquito biting you? But it helps with those, okay? Odomas maybe 6 to 8 hours. A lot of people like to use citronella, and citronella is in a lot of the, like Baygon sprays, as we call them. but it's 2 to 3 hours, so you have to do a lot of reapplying, because mosquito will bite you after the 2 or 3 hours, okay? School is going to start back for sure shortly, and I'm not sure if the schools are going to allow the students to wear long clothing if their uniform is short or if there's half skirts. But I really would advise the schools, if they're listening, to do that, because at this point we really don't want all of our students to end up having dengue and overwork the health system that is already overworked. The clothing that you wear, mosquitoes for some reason could bite through. If you have on a tights, they can bite you, and especially black clothing and dark clothing, they can bite you. So to increase that, you could spray the clothing with the insect repellent, and that could give you some added protection. Even things like mosquito nets, they actually have some treated ones. There's a chemical in it that actually upsets the actual larva and the reproduction of the mosquito. And for example, where that comes in very important is if you already start to have symptoms, say like you have fever and you feel, but wait, maybe it's dengue you're getting. That is a good time to go under that treated mosquito net to prevent transmission to your other family members, okay? So that is also some of the things that would at least decrease it. The insect repellents that I spoke about could either come in creams, gels, and so forth to make it easier for to use. They have different strengths for children. So really and truly, we have a lot of things out there. I also want to, I'm not sure who I should ask for this, but some of them are expensive, and I don't know if the government would consider decreasing the taxes and prices for some of the repellents because of the situation that we're currently in. Because they would have made adjustments to certain things, like when the COVID time and so forth. And we really need to be able to protect our children and persons from getting dengue, because it can lead to death, right? So if you're worried about any symptoms that you may have, and you're not sure, we have a lot of clinics now and health centers in your district. You don't have to, not everybody have to run to hospital. Clinics are open. Some are open 24 hours, some until 7. You can come to your clinic. There's a doctor there, and figure out which one of them you have and get treatment if you need to.
Okay, well, I think that's a good note on which to end this week's edition of Roundtable Talk. Thank you very much, Dr. Quashie Browne, and also Mr. Carlos Wilson, Senior Environmental Officer. Thank you very much.
Thank you for having me.
I do hope that people listen and take in some of the advice that you have given, and with schools opening in another week or so.
Second.
Yes, the second. Okay, thank you again, and we'll see you again next week for another edition of Roundtable Talk. Good evening.